So, I know it's been a while. And I had a video updating it done, but I'm going to try to make these a little bit more regular again. About a month ago, I finally had the skin removal surgery. It was a really long surgery. It was like supposed to be 7 hours, and it took a little bit longer than that because I had a skin removal on the abdominal, and I had the abdominal muscles tightened, and I had this excess skin removed from my breast as well. The surgeon was actually thinking it was going to be closer to 8 pounds because he was expecting fatty deposits, because I guess that's, you know, fairly normal. But when he weighed mine, it was only 6 pounds, and he told my other halves that there wasn't really any fat, it was all skin. So recovery has been not difficult, annoying. I did have a little bit of a setback. I did get an infection. I ended up in the ER, which landed me in the hospital for 3 days. But they gave me some really strong antibiotics. They were going to do like a PICC line and transfusion, but they gave me antibiotics. And fingers crossed, so far so good. 3 or 4 days after surgery, the tubes from my breast came out, and that left them sore for a few days. And even now, sometimes I feel like that's a little bit more sore underneath my arms, and that could just be because, well, they're rubbed more, I guess. I still have the one coming from my stomach, which is a bigger pain because, something you don't think about, you have to take that into account when putting on pants, or as the surgeon calls it, the super suit, the garment that the binder type garment that you wear after surgery. I found out why that's necessary too. The second that binder comes off and is left off for any length of time, you start to swell, and you swell, and you swell. And shorts that I fit into, I didn't fit into. And so we put back on a softer, not quite as limiting. We put on stuff more like Spanx, and that helped with the swelling. So I was able to put back on my shorts. Yeah, it's a lot of lotion. For the scars to help minimize the scarring. Self-care. I came home from the hospital, and one thing I didn't expect is everything that I ate prior to going in. All of the foods that I was eating that was helping keep my weight down, all of them just tasted horrible to me. I'm starting to get back to that. It's taken me a while. But, you know, I keep thinking, I started out at almost 300 pounds. I'm now hovering around 130, 140, maybe 145. That's still, on most days, you think about it, that's about 160 pound weight loss. And, you know, you get people that are just trying to lose 20 or 40 or 60 pounds. And I went and I lost 160 pounds on, you know, we'll just say about that. I'm not saying it's not unheard of. It's just not as common. People don't usually have that much of a massive weight loss unless, of course, they have that surgery. You know, like a gastric surgery. I didn't. And when people would say, well, if you cut out soda and sugary drinks, you'll lose a lot of weight. And I remember thinking, yeah, right, it's a fucking soda. You're not going to lose that much weight. Okay, well, consider this. If you're drinking, on average, 4 sodas a day, think about how many calories you're consuming. Because depending on the soda, 170 to 240 calories, 4 times a day. You're drinking half your calories. And if you're drinking that much, how much are you eating? And it started that way, you know. I knew that I needed to be healthy. We have heart problems that run in my family, and obesity is a big thing in my family, and I didn't want to be the next one. So it started with soda. I thought, well, you know, this is what they keep saying. We'll see. I was like, I don't want to make that much of a drastic change. Well, as time went, I made more and more changes. Like, I didn't join a gym until I was like 6-8 months into it. I was like, I don't need to join a gym, you know. the more you lose, the more compelled you feel to do better. You don't want to just lose the weight. You want to build muscle. You push yourself more and more because you want to see what your body's capable of, you know. I walked 5Ks, you know, I participated in like the MS walks and whatnot, and then around Christmas time this last year, I did a 5K run, and I finished, for my age group, I finished like in the top 5, I think. Overall, I finished in the top 15 of runners, you know, so I thought that was great. I'm running, on average, about an 8-minute mile, when 2.5 years ago, I'd be lucky if I could run a mile, let alone an 8-minute mile. Never did I think that I would be getting skin removal surgery. Never in my wildest dreams. Of course, never in my wildest dreams did I figure I'd ever even see a size 2, let alone be able to fit in it. I was used to being, you know, and I have 3 girls, age 22 to my youngest is 14. Never did I think that I would be smaller than my older 2 girls and closer in size to my younger one. It's taken a long time to get here, and, you know, yeah, maybe 160-pound weight loss isn't in your future, but if you start somewhere, you start taking some of that unhealthy stuff out and putting in healthier stuff, you know, instead of munching on chips, munch on banana chips. Instead of doing, you know, ground beef tacos, do a fish taco without, you know, all of the sauces. Small changes. Instead of doing a big salad with the meats and the cheeses and the dressing, try doing it without the cheese. Try doing it without the dressing. You know, make little changes. Instead of doing it with the fried chicken, try it with the grilled chicken. And, you know, you might accomplish, you might reach your goals. I'm sitting here today making these videos because I never thought I would be. And I want to share these experiences and let everyone else know that it is possible. Because if you go back and even look through my videos, I know in one of them it shows a picture of where I started. And I know if you look at my videos, I know you'll see the change just over the last year in my appearance and the progress that I've made. But I did have the skin removed from my stomach, and it really bugged me. And maybe I'll get around to posting pictures of the skin. I'm not sure on how I feel like that, but I'm supposed to have the skin removed from my thighs. I'm not too sure. I mean, I want to have it gone, but I don't know. It's been a hard recovery. I mean, not a hard recovery, but just like a long recovery. I'll talk to my surgeon more and see what the recovery would be like for that. I'm sure it'll probably be easier. But I miss being able to go for my morning runs or go to the gym or just do things for myself. And when you have your abdominal muscles cut, it makes it hard. You can't lift anything or reach or stretch or lift yourself or lower yourself into a chair. You have to have help for a lot. You can't even cough or laugh. Those have been some of the harder things for me. But if you're bigger and your weight bothers you, you can make changes. You can make small changes that can have a bigger impact. It's not impossible. I'm not saying it's going to be easy, but start small. Sometimes it's all about baby steps. I mean, currently I'm not wearing my Fitbit. Crazy, right? But with the surgery, I didn't want to be worrying about that because I always worry about getting my steps and hitting my goals when I have my Fitbit on, and not really something that's possible to do. But yeah, I just want you guys to know I'm recovering. I'm doing okay now, and if you set your mind to it, even making small changes can have huge impact. So go out there and start taking those steps and making those changes. It's possible.